We're getting lots of interesting questions about whether it makes sense or if it's even safe to get more than one type of vaccine. Lauren in Monticello says, I know of a person who refused the second COVID-19 shot because what was available was the brand not received at the first shot. Is mixing Pfizer and Moderna shots okay or a problem? And Juanita says, I've taken one of the vaccines and I'd like to also take another one to get better protection for COVID-19, especially the new variants. Is that safe and can it be done? This question's getting lots of attention after a New York Times article last month reported health officials in Great Britain changed their guidance to allow for a mix and match vaccine regimen. So, is that safe and a good idea? Well, let's take a look. Our sources are Public Health England, the CDC, and the journal Nature. England's official health department is not really advocating that citizens get different vaccines. The agency's latest guidance says every effort should be made to complete dosing with the same shot given during the first vaccination. But when the same vaccine is not available, or if the first product received is unknown, it is reasonable to offer one dose of the locally available product for the second vaccination. Here in the United States, the CDC takes a much stronger position against mix and match COVID-19 vaccines. The CDC website says taking any of the approved vaccines is okay, but COVID-19 vaccines are not interchangeable with each other. The safety and efficacy of a mixed product series have not been evaluated. Both doses of the series should be completed with the same product. And the agency says different vaccines should be administered only in exceptional situations. The journal Nature reports British researchers launched a new study last week to determine the impact of giving the Pfizer and AstraZeneca vaccines and whether that could even boost someone's immunity response compared to getting just one brand of vaccine. But getting the results of that study will take time. So, is it safe to mix and match different types of COVID-19 vaccine? The answer is we don't know yet. It hasn't been tested, so we don't have that answer. But the CDC and England's National Health Department both strongly recommend sticking with one type of COVID-19 vaccine for both doses whenever possible. Have a question you'd like us to verify? Send us an email at verify@wthr.com.